I'd like to welcome our podcast audience today to an excellent opportunity to meet someone who has had an extraordinary amount of experience in terms of cardiovascular nursing care and also with PCNA. Terry Thomas, could you please introduce yourself to our audience?
Hi, this is Terry Thomas. I'm clinical nurse specialist, and I've been in prevention and really founding member of PCNA. And the journey has been an amazing one because in the early days, some of the folks that we went to said, "But you're a nurse," and we said, "But nurses get the work done. Nurses, implement things." And so it's been a great journey. I have valued the interacting with my colleagues over the years, many sharing ideas over these last 30 years as the PCNA got started. Hard to believe it's that long. I've shared ideas. I've learned a lot from PCNA members. I encourage you all to do the same. My clinical career has spanned from running individual prevention clinics to expanding to a more population-based heart disease prevention program for the state of North Carolina, doing outreach, screening, assessing, bringing high-risk women in, to then going on to population health initiatives in cardiovascular risk reduction with employer groups and advanced cardiovascular labs and genetic tests and inflammatory markers. And now at this point, it's rewarding to be involved on a larger scale in heart disease risk reduction and stroke prevention in large populations such as health systems and in private practices. And I can only stress that this organization is one of the strongest. It is the go-to organization. And as prevention nurses, look for opportunities to share and collaborate. Join the chapters, get involved, recruit other colleagues. You have so many tools at your disposal that other organizations just don't have. And I know and feel strongly PCNA is the go-to prevention organization. So I encourage you to reach out, to interact, to collaborate, to share ideas. That's the best way we learn. That's the best way we learn.
I am so excited to have the opportunity to spend time with somebody who's seen such changes in the industry and in the respect that nurses continue to really need and really deserve. I know that it's not always easy to share your opinion or share your thoughts, but what kind of strategies would you suggest to somebody who's a little bit newer to being a cardiovascular nurse in terms of making sure they feel heard?
Well, that's a good question. I mean, let me make one comment here before. Healthcare falls down on implementation. And so I think when we think about it, I know who gets the work done, and it's the nurses. And I can just give you a quick anecdotal. I taught lipid clinic training programs at the University of North Carolina, and when the nurses came alone, the programs got started. When the nurse came with the physician, the programs got started. When the physicians came alone, programs didn't get started. So I know nurses can implement. I know nurses can get the job done. So my advice would be, take your idea, align yourself with like-thinking colleagues, and go for it. Dream big. Dream big in prevention. Have a big vision. So for colleagues that are, what the question was, a little bit afraid, I'd say reach out to others in our organization and say, help me to understand what's worked in that situation. Where might I go? Use your resources, use your colleagues, join the chapters, because I believe, why reinvent the wheel? I mean, we don't need to be in our little silo. We need to be spreading the word. We've got a lot of work to do.
That is a very accurate statement. There is an ongoing workload that continues to increase as more and more people age, as more and more people are being diagnosed with cardiovascular disease at early and earlier ages. So there's no end in sight. That's our goal, is for us to work ourselves, if you will, out of a job, because we're trying to eradicate cardiovascular disease, but it's not going to happen overnight. So it's definitely a team effort. So you've talked about reaching out to colleagues, reaching out to others in your organization, and looking for resources. Are there any other resources that you would specifically point to that you have found useful? I know, for example, some people who are in clinical application of cardiovascular disease prevention and management, they look to the guidelines. And those are ever changing, and making sure that you know what those latest guidelines are is very important, for example. But sometimes they're tough to wade through. They're very as they should be. They're very comprehensive. But that's an example of sometimes an organization will put together some bullet points to get you started on what the latest and greatest are. For researchers, there might be other kinds of references or resources that you would go to. What are some things that have been really helpful for you?
The resources that I've gone to are what are best practices. I feel like, the guidelines can be tough. I mean, I've worked in an advanced lipid world, so I've been in another realm that's a little different than that. But I would just say that the resources are going to be within this organization. If you have patients with heart failure, we've got tools. If you have patients with lipid disorders, we've got tools. So I think take advantage of every clinical resource that PCNA has to offer, and then talk amongst your buddies. There should be no shared, there should be no secrets in this prevention world. We need to collaborate.
Excellent. We are going to take a quick break, and we will be right back.
For more education, resources, and tools for your clinical practice, visit PCNA.net. You'll find CE courses, patient handouts, and more, all free to access. Visit PCNA.net.
We are back talking with Terry Thomas, one of the founding members of PCNA, and we're going to take a little bit larger view in our next part of our conversation and talk about affecting populations. Terry, could you tell us a little bit more about what that might take?
Well, I think, as I said earlier, I've worked one-on-one with patients, then to bigger clinical programs, to employer health programs, and now working in the realm of heart disease and stroke prevention in health systems and larger things. So I think that, with all the work we have to do, it's important to look for opportunities in your area. How can I improve healthcare within my clinical practice? How can I improve cardiovascular risk reduction in my clinical practice? How can I improve it in our health system? Don't be afraid to ask the tough questions to your colleagues. And I guess I've been blessed because I've aligned myself with like-minded thinking people, and to me, that's the way to go. And so if you can find those people who let you run with clinical ideas and build the programs, to me, it's the biggest win-win-win. And so I think, again, ask your colleagues in PCNA. You've built this kind of program. Tell me how you did it. Help me learn, help me understand how you got from here to there. Because we have a wealth of knowledge to share. All of us. I mean, I've been on this journey with PCNA since the inception, and it's just been incredible to watch the growth. So I would encourage you to get involved, recruit your buddies, take advantage of every clinical tool that we have, reach out to PCNA, they're always there to help. I've reached out to them many a time. And so it is a fabulous organization.
Well, thank you so very much, Terry Thomas, for being with us today. I hope our audience is as inspired as I am after our conversation. This is Geraldine Warfield, your host, and I will see you next time.
Thank you for listening to Heart to Heart Nurses. We invite you to visit PCNA.net for clinical resources, continuing education, and much more.